My name is Keith Stack. I'm working with the Columbia County Board of Supervisors on its opioid response plan. I'm a Kindred resident. I'm currently the Executive Director of the Addictions Care Center of Albany, which is a program very similar to Beth Schuster's Twin County Recovery Services. I'm also a person in recovery from addiction. A very timely meeting tonight, very timely forum tonight. I was just informed that the President did in fact declare the opioid epidemic a national state of emergency. So again, I mean, this is a national problem, it's a state problem, it's a community problem, and all of us together have to work together to find solutions to it. And on that point, in January of this year, Chairman Matt Murrell, Chairman of the Board of Supervisors, convened a task force of public officials and private and public nonprofit service providers to, try and get their arms around the problem in Columbia County and to develop a response plan. And there were several, points to the plan that this group was charged with. And I just want to read those. The purpose of the plan is to clarify the nature and extent of the opioid abuse problem in Columbia County, the full measure of public and private resources being utilized to address this problem in Columbia County, the best way to organize and enhance these efforts, and what, if any, new initiatives should be considered to complement and or expand upon the current efforts. An important part of the county plan, and frankly responding to the opioid epidemic generally, is public awareness and communication, and that's really the point of tonight's forum. We're going to have a group of panelists up here, experts in the county, people who've been addressing the problem for years, decades really. So they know what they're talking about. They're the service providers, but they're also looking for input from the community on things that they may want to do differently or do better, or just some new approaches to this problem. So we're going to start with the panel discussion, and then we're going to have a question and answer period. So I just want to introduce the panel first. We have Supervisor William Hughes Jr., 4th Ward of Hudson, District Attorney Paul Chaika, Sheriff David Bartlett, Beth Schuster, who's the Executive Director of Twin County Recovery Services, Michael Cole, who's the Director of the Department of Human Services, Columbia County Department of Human Services, Teresa Lux, who is the Executive Director of Catholic Charities for Columbia and Greene Counties, Victoria McCann, who is a public health educator for the County Department of Health. Then we have Commissioner Robert Gibson, Department of Social Services. So we'll start right now. We'll start with Supervisor Hughes.
Okay. Well, first of all, I'd like to say thank you all of you for coming out. It certainly is wonderful that we can sit here and talk about this issue that really is plaguing, like Keith said, that's plaguing Columbia County. I do want to admit, though, that I'm definitely not an expert, and in fact, I probably know less than a lot of you sitting out there in the audience. What brought us here today and what got the plan started in Columbia County, so I want to give a brief overview because I've been hearing people asking about that. And so, truthfully, I don't care when it started. We're doing the work now, but I know some people would like to know how we got to where we are today, so I will give a brief overview on that. It was actually almost a year ago today that I was at a block party that was being thrown by the Department of Neighborhood, and I overheard Judge Connors talking about the overdoses that were taking place in Hudson and throughout Columbia County. And I walked up and I was really talking about it. And he started explaining to me the brevity of the problem. And I was like, well, what are we doing? He said, I had no clue. So I immediately, the very next day, went to Chairman Morrell, who immediately called a meeting. And in that meeting, we had the sheriff and the DA and some people, the commissioner, acting commissioner at the time from DSS, talked about the issues. But I wanted to know more about what were the service agencies doing, and what did we on the Board of Supervisors contribute to that, or were contributing to that. So then I had subsequent conversations with Schuster, Bear Party, Teresa Lux, to find out that we were contributing to all these agencies. They were talking to each other, but we weren't communicating with those. When I say we, meaning the board of supervisors. And in fact, we didn't have a real understanding of how much we were contributing and in what way. And so the chairman, and that's when the chairman decided that he was going to put together a subcommittee, have us draw the plan so that we could see where we were contributing, we could see where the gaps were, and we could also see where the overlap was. And what was important about that he did that, is so that when we move forward and we're making decisions, we would better be able to make decisions that would be wise, that would serve the taxpayers and the people of Columbia County the best. And so that's what the Opioid Epidemic Response Plan, we hope, will do. It is certainly not a document written in stone. I've always said that from the beginning, it is a fluid document. It is something we put together where we would be able to bring all the agencies together, profit, nonprofit, people working in the community, to come up with ideas that will best serve the people of Columbia and also Greene County, because we're looking to merge with the people with Greene County as well. So that's basically how we got to where we are. All these people up here, they will tell you what their part is, but early on, we've been meeting actually on a weekly basis. I mean, we were putting a lot of time in on this. Myself, I was very uneducated, and these guys grabbed me up pretty quickly and corrected me when I needed to be corrected. And so I'll pass it on to them and let them, each one of them tell you what they do as far as working on the plan in the subcommittee.
Thank you, folks, for being here. I recognize a number of you because you, like so many of us, have friends and family involved and suffering from the terrible, terrible crisis we now face. In fact, if I've learned anything in the years that I've been fighting this with you folks, I've learned that this is a problem that knows no boundaries. Every family that I know is somehow affected, directly or indirectly. And I've learned something else in my time as in the business, and that is it is impossible to incarcerate ourselves out of this crisis. Although I strongly believe that law enforcement with the leadership of Sheriff Bartlett is extremely important and absolutely necessary, especially for those people who are profiting from this scourge. Having been responsible for putting so many people, so many addicts in prison over the years for such long periods of time, if I've learned nothing else, I've learned it does not fix the problem. So we, with your help and with that of Chairman Norrell, who I commend for putting this together with Supervisor Hughes, perhaps we'll be able to fix it. We're not going to fix it nationwide, and we're not going to cure it. But with your help and with your diligence, perhaps we can at least get a handle on it and slow it down. Thank you for being here, folks, and thank you all for having this forum.
Well, thank you everyone for coming. I'm going to get into some of the programs that we have at the Sheriff's Office. First, I'll start on the law enforcement end of things. Currently, we have absolutely the best working agency stuff going on now with all of our partners. City of Hudson Police Department, State Police, DEA, Sheriff's Office, the District Attorney. We actually formed a small task force recently when the overwhelming overdoses happened back a little while ago. And we are working on that aggressively right now. That case is being worked on. I currently have one investigator assigned to DEA full-time. They're working the larger cases. I have one investigator working fentanyl task force, and I'll get into fentanyl in just a little bit because I wanted to touch on that because I'm sure many people in this room have been trained with Narcan. So I want to touch on that fentanyl quick towards the end of my talk. The chairman and the board of supervisors just granted me another narcotics investigator for street-level dealers 3 weeks ago, and that person is now on the streets. So we're trying to approach this at a multifaceted approach as far as going after all the different dealers in our area. It's around, it's here. Those men and women that are working right now are very busy. A lot of the crimes are associated with some type of narcotics in a way, whether they're stealing to try and take care of their habit or getting retribution because somebody didn't get paid. We had a home invasion the other night that we're working on. So it's busy on the law enforcement end of things. But rest assured that all the agencies are speaking, all the agencies are talking, all the agencies are working together to make our community safer right now. On the flip side of the coin, different programs that we've had going on here at the Sheriff's Office. We were the first agency to implement an Narcan program full-time in the county. To date, we've had 26 saves. I've got a save myself. Great program. Just if you are trained with Narcan, be extremely careful of any of the products that are laying around when you're in the houses, when you're working with somebody. The heroin is one thing, the fentanyl is another. Extremely, extremely dangerous. Last week alone, a deputy and a nurse down in Virginia saved an individual with their Narcan. They were exposed to fentanyl. They were taken down for a little bit. And they were okay, they've recovered, but it's extremely dangerous. Basically, if you take the tip of a pen and ingest that, you're gonna be pretty sick, extremely sick. And it can be fatal. So be careful if you're out there using your Narcan. Another program that was started in 2014 when I first came in, the Narcan program. Another program that we started, and we're also training in that too. So if anybody needs anything as far as training, Narcan training, let me know. We have a couple of investigators actually that are trained. Second program, which I'm very, very proud of, is the Vivitrol program that we started in our correctional facility. Our facility is probably, I'm being easy on it, 80–85% addicted to something in one way or another. And the Vivitrol program we started, there were 2 counties in the state in 2015 that started this program. Orange County was number 1, Albany County was number 2. We were number 3 in the state to do this. And Vivitrol is a drug that we would give an individual that's in the jail just prior to their release. And it curbs their cravings for the opiates. What we do prior to that, we have Twin County best people assigned actually to our facility to help work with these inmates, to help work with these people that have the addiction, to hopefully when they get out, they won't have that, and they won't reoffend. We've also got one of Bob's people as an inmate services coordinator now, and they're all working together in unison to try and help these people when they get out. Because let's face it, again, they're robbing, they're stealing, they're breaking into places to get money for their addiction. So hopefully, when they get out, we can hand that off to Beth and to her people. They run with it from there as far as trying to get them better with their addiction. Another program that we started up that we didn't have for a while was the DARE program over in Chatham. That wasn't up and running for a couple of years, and we were able to get that running again. We're hopefully working on getting an older DARE program going. We're speaking about that now, where instead of just hitting the kids in 5th grade, we're also hitting them up in the older levels, the 8th, 9th, 10th grade, and just going at them twice. School resource deputies have been a phenomenal success that we put in when I came in 2014. The kids actually love the deputies. They love talking to them. They trust them. And we get a lot of info. We get a lot of kids coming up and talking if they need help, and we can point them in the right direction on which way to go. So I want to echo on what Keith said right in the beginning. You know, it takes a community to make our community better. And everybody needs to step forward and work on that. And I appreciate everybody being here tonight, because I've been to forums before where I've had 2 or 3 people sitting in the room. And ending, if you have any drugs that you need to get rid of, okay, don't flush them down the toilets anymore. We were able to get drug drop boxes. And there's a couple, City of Hudson's got one, we've got one. Chatham get one? Yeah. Chatham's got one, Chatham Police have one. Please, nobody asks any questions. Green box, drop your drugs, walk out the door. We don't want them on the streets. That's where it's starting with the pills. And when the pills get too expensive and they can't get the pills, then they go to heroin. And we also don't want them flushed down our toilets, because then it gets into our waterways and it gets out into our ecosystem. So Thank you very much.
I'll just echo everyone else that's spoken with their welcome. It's great to see everybody here. My name's Beth Schuster. I'm with Twin County Recovery Services, and if you don't know this, we operate addiction services in both Columbia and Greene County and have since 1978. We have an outpatient clinic in each county, which is supervised by a medical director. We have a women and children's residence in Greene County called Riverside Recovery Residence. We have a men's residence in Hudson, which is called the Red Door Community Residence. We have intervention programs in Greene County, some in the schools and some with intervention counseling for high school students. We have a addictions counselor doing screenings at the Department of Social Services, both in Columbia and Greene County. We have a counselor full-time at the Columbia County Jail, and we're really proud of that project. I guess, you know, the biggest reason is that the county funded that project 100% when we started that, and has always continued to support it. We work with a lot of people there doing individual and group therapy. We do a lot of referrals to inpatient rehab from there, and of course referrals to outpatient programs also. Twin County Recovery Services is also very much involved in the drug court in both Columbia and Greene County. We have people on the drug court teams, and we've been with them since they started. And I can't advocate for that program enough. We have a lot of wonderful stories come out of there. Not everyone is successful, but not everyone is successful at anything. But it gives them a real, genuine chance to kind of turn things around and not just stop using, but get other areas of their life together. Because recovery from addiction is more than just not using the substance. It's a whole life change, attitude change, and that's where treatment comes in. We do a lot of referrals from our own clinic for detox and rehab. We are limited somewhat because of insurance approval that we have to get ahead of time. And also, if there's an open bed or not, there's not always open beds. This presents difficulty when you have somebody who's finally willing to go and you can't find a bed for them. And nobody's more frustrated than we are about that, believe me. And if I had a wand, that would be one of the first things I changed. I'd wave the wand and allow everybody space. However, but it's wonderful to be able to see the people that we see, to watch the change in them. Many people come through the program more than once, more than twice, maybe more than 3 times. It's okay. If people realize that this is an illness, like any other chronic illness, you don't get better in the terms of totally recovered, but you get into recovery, which is a lifelong process, and that's what we hope people get into. We're only with them a short time. It's the community and self-help groups, and sometimes churches and pastors, best friends, parents, other people that support recovery, other people that remind them that they are valuable human beings and they're worth trying to do something for. And I think that's a message that not enough people who are addicted get. They come into treatment, they feel pretty low, pretty worthless, and it takes a while to turn that around. But it's well worth it. It's worth it when you see people do well. I'll be glad to answer questions later, but I don't want to talk all night, so Michael Cole.
Good evening, I'm Michael Cole. I'm the Columbia County Director of Community Services. It is really powerful to see so many people here, and it is, I am grateful for the laser focus of the Board of Supervisors and the talent and compassion of the range of people that are in this room tonight. I don't know all of you, but I do know some of you. That is very powerful. I am responsible for planning and oversight of substance abuse services in Columbia County. These services range from disease education, stigma reduction, prevention, assessment and referral services, treatment and care coordination, and recovery supports. I work for the Board of Supervisors for Columbia County, and I also work for the Community Services Board for Columbia County. The Community Services Board oversees services related to individuals impacted by mental health issues, substance use disorder issues, and intellectual and developmental disabilities. So those features of the service delivery system I am responsible for. What we do is we continually survey the quality and the quantity of every type of service that I just mentioned in Columbia County. We work with a range of stakeholders, and we don't stop at the borders of Columbia County, but we focus primarily on what we need, what we have, what we don't have, what we need to get, how to get it, and then to monitor continuously the quality of that, and then to go back from the beginning and just keep doing that. This has been a process that has gone on for years and years. We are challenged by limited resources and geographic and stigma barriers and other barriers, but that will never stop us. We have to ask questions like, do we have the right services in the right place at the right price? Are these good quality services? Do we know that they have an impact? Is there transportation available? All of those questions and many more have to be asked, frankly, and it is done in a public forum, in the Community Services Board and the Board of Supervisors. Both of those organizations that I report to are public meetings and depend on the participation of the public. We get these survey results, whether they're formal or informal. We find out what the community needs from a variety of different sources, and we work collaboratively to try to meet those needs. Once we identify the gaps, try to get funding or resources of some kind to fill those gaps, and then monitor the quality of those services. And in some cases, because we produce an annual plan to the state, we are able to obtain state aid and pass that that funding on to a variety of different not-for-profits to fill those needs that we identify as being unmet. Currently, the county receives approximately $1.2 million in a variety of different, supporting a variety of different programs that either directly or indirectly support services related to substance use disorder. I wish I could say that the problem is simple and the solutions are simple. They are not. I don't think anyone here is ready to say that. This is a very challenging epidemic with a disease, a brain disease that is unlike anything I know of. Perhaps you know of something that is like this. Our county, Columbia County, and my department also operates a outpatient mental health clinic for kids and adults, and we offer child and adult care coordination services. And what we do very well, that I'm very proud of, is work in collaboration with other service agencies and planning agencies and cross silos. And we're always looking to expand our stakeholder input. So I appreciate your presence tonight, and I'll be happy to answer questions afterwards.
I'm Teresa Lux, Catholic Charities of Columbia Green County. Thank you for coming and having us. It's a puzzle, and it takes a lot of different pieces to get it all together. Catholic Charities of Columbia Green County has the prevention education program. The funding starts at the state level from the New York State Office of Alcohol and Substance Abuse Services, and it goes through Mr. Cole's arena. We're one of those agencies that he is part of the work plan, part of what's going on in the county, and it funnels through us. And we've been doing it for quite a number of years, I've got two of the most wonderful, dedicated, knowledgeable, talented prevention coordinators. The bulk of their time is in the schools. And the idea is that prevention education starts early. The earlier you start it, the more of an impact that you're going to have, the less of an intervention that you're going to need later in life. So you need to start it young. Our program goes from K through 12. In the early years, we're focusing on self-control, communication, emotional awareness. What are your emotions? What are you feeling? How do you handle them? What are good ways to do that? In the middle years, drug resistance skills, peer relationships, reinforcing some of the anti-drug attitudes that we started that conversation in the elementary years. What's nice about our program is, particularly in Hudson, we're in K through 7. They start working with the kids in kindergarten. See those same kids in first grade, see those same kids in second grade, third, fourth, and on up. In school, you change teachers every year, but our prevention educators have been the same for many years. So they're still seeing the same people, sharing and reinforcing those same messages. It's really important to continue in the high schools in order to have that benefit that you've created from the elementary and the middle schools. You need to have that high school component, which has been challenging due to the academic schedules as well as our capacity of being full. So other than the specific topics, what you can say is specifically that the prevention educators are working on are two things. Protective factors, they're trying to increase those and reduce your risk factors. Think about if you want to avoid getting an infection. If you're going to go into the kitchen and you're going to chop your vegetables, do you know how to use the knife? Do you know how to use it safely? Is it clean? Is it ready and prepared? You're protected if you have that knowledge and you have those items ready, a nice working knife. You're at risk if maybe you don't have access to clean water. So the knife is still dirty from 2 days ago when you used it. So in the event you do get cut, you're at risk because you've had an added piece to it. You're protected if you know how to clean that cut as well. So you're trying to keep an infection away by increasing that knowledge, protecting yourselves, and also reducing your risk of exposure to it. And that is what the prevention educators work on. We do more. As everyone here is talking about all the different aspects of to address this crisis, prevention education isn't just in the classroom, 6-week sessions, evidence-based. They are everywhere. Honestly, you'll see them everywhere. They are reinforcing healthy lifestyles in the after-school programs, the summer recreation program, the youth clubhouse, holding the bike rodeo, teaching the young ones, keep your brain safe. It's the most important part of your body. How do we keep it safe? We start young with the bicycle helmets. They reach the adults at community events. We'll be at Community Night Out. We were at the Book Festival, Flag Day, assemblies, sending letters home after they've done something in the classroom with the children. A letter will go home, so keep that conversation going. Supporting the schools and the communities. We're on committees, we provide them guidance. We can't be in every classroom and in every school, so if we can't, we can provide the expertise in a different manner so that the information can get out there. Reducing the supply. We want to get things off the street. We have worked with the Sheriff's Department, the City Police Department to do the medication drop boxes. Let's get the stuff in a safe environment and away from the hands. And then we work in collaboration with everyone at the table and everyone in the community. We can't do it by ourselves. We have to definitely work together. So we're on a lot of committees, do a lot of special events. All of us have the same goal, and it does take that village piece to help us all get there. And I'm very happy that prevention is a part of that, so that we're not constantly having to be responsive. We're not reacting to what's going on. We need to kind of reduce it, and the way to do that is through prevention education, which is what Catholic Charities does. My sister agency, Catholic Charities Care Coordination, does Narcan training, so if you're not able to get connected with the sheriff, they do the Narcan training once a month down at Twin Counties, again, trying to keep all our individuals safe. I had a magic wand. We need more money to have more staff. We've put in the request several times to the state. They're full. They're absolutely full, and they're doing a lot of juggling to meet all the needs and all the requests. And we're very excited that the various schools, we cover the whole Columbia County, want us. And it's really hard to say, no, I'm sorry, I'm already booked, I can't come and do something. And so we put in some requests for trying to get additional staffing so that we can do additional classrooms, additional schools, and more of those additional outside of school events, because it is important to do the whole person and the whole wraparound.
Evening, everybody. My name is Victoria McGann. I'm the public health educator for the Columbia County Department of Health. We operate under the State Department of Health, and part of that means we have to answer to a lot of the state's requirements, one of those being the Community Health Improvement Plan. This begins with a review of all sorts of data pertaining to virtually any health or quality of life issue for Columbia County residents. We look at all that data, and from that we choose priorities. We did this last year, 2016, and in the summer of 2016 we chose obesity prevention and substance abuse prevention. And since then, we as a department have really been working to try to become a more active partner in the fight against the opioid public health crisis. So at the start of implementation of the Community Health Improvement Plan last November, we dedicated another person, in addition to myself, to help implement that program, working on education, awareness, and systems level changes to substance abuse prevention. This includes streamlining existing efforts, identifying gaps, and also monitoring activity that's looking at the numbers of overdoses, the numbers of naloxone administration or revivals, and the amount of emergency department visits because of drug use. Much of our day-to-day work includes acting as a resource for a lot of the community groups already meeting. We're a member of the Controlled Substance Awareness Task Force with a lot of the folks you see up here. We work on the Community Prevention Education Work Group, the Prescriber Education Initiatives, and along with our community partners, our staff is responsible for the Hudson Junior High Prevention event in October of 2016. We worked with Albany County Sheriff's Department to bring down their mobile drug education bus to Hudson Junior High and arranged a panel for the students, including Sheriff Bartlett. We had a person in long-term recovery speak to the kids. We had a person suffering a traumatic brain injury because of his substance use. And we had a New York State drug analyst talk to all the kids in an assembly-like format. We also put together a parent program this past spring, shifting the focus to educating the parents on the same issues and trying to identify, risky behavior in their children and their children's friends and the like. So we've also partnered with the Sheriff's Department in other education initiatives. We went to all the senior centers and we talked about the medication drop boxes, talking to the seniors about what exactly they should be trying to get rid of, and just so that they do have a part to play in prevention and keeping those potent prescription drugs out of their own hands. And as a department going forward, we are in the beginning stages of negotiations for more hands-on prevention role in the schools, collaborating with the Mentor Foundation USA and the Rip Van Winkle Foundation for the Living the Example program. This is a youth-driven prevention program. Youth ambassadors are identified. They go through training for creating positive substance prevention messaging to share on social media. This is a program being researched by George Washington University out of Washington, D.C., and we're very excited about this going forward. We're in the very early stages now, but we hope to iron this out and roll it out by 2017-18 school year, including 4 school districts in Columbia County, including Hudson City School District. So we're really looking forward to the changes and things that could bring for our community. And I'm very excited to be here. Thank you for having me, and I look forward to the feedback that you provide. So, thank you.
Evening, folks. I'm Robert Gibson. I'm Commissioner of the Department of Social Services. I was proud to be asked to join. I'm glad to participate in this panel. also the subcommittee that spurred it. Very briefly, you know, the Department of Social Services really sits at the crossroads of this problem. We see it in every unit of our building. We see it in Children and Family Services, and we see it downstairs in eligibility. We may not know the full extent of this problem, but we have known for quite a while that it's grave and it's growing. I'm very pleased to be joined tonight by the folks on this panel, and my department depends on them to put plans into action. And action, I think, is the operative word here. We're involved in a lot of preventive services on the funding side of it, but for implementation, as wonderful as all of the workers in my building are, and they are, and as concerned as they are, as they manage their cases, they turn to the people responsible for execution. And I can't think of somebody that's been more prominent in executing a plan to move us forward out of this than Beth Schuster. She mentioned before that she has a screener right in our building that plays a pivotal role in what we're doing. Anybody coming in need of assistance by state law now has to be screened. That is part of the eligibility process. I depend on the best folks to do that, and they do it. And that screening is very thorough, and it has helped us find people in need of help that I think in the past would not have been found, and they receive that treatment. So, you know, very pleased to partner with that. Very pleased to partner with the district attorney's office. We share a number of cases and have for several years. And I was a member of that office before coming over to social services. We used to discuss at that time the climbing rate, not just of overdoses, but unfortunately deaths that came as a result of the overdose. It's been a surging problem. We knew it then. We know it now. I've had a sort of up close and personal view of what people at the county agency level have been doing to combat it, and more importantly, the resources that they lack to do more. And if anything is frustrating to me, it's the lack of resources to bring more to the solution. But I think this group has worked hard to identify some of those gaps and identify some of the ways that we can close those gaps. And it's for that reason that I thank the Board of Supervisors for putting everybody together in a room and for tasking us with coming up with a plan for the residents of this county, and as Supervisor Hughes mentioned, in conjunction with the residents of Greene County. It's really a twin county, it's a nationwide problem. We are really focused on it here in the Twin Counties. That plan certainly brings the issue more into focus, and it certainly makes us take a look at the services that are available. It makes us take heed of those services that are not available because of lack of resource, and we're able to bring all of our offices together in order to get after this. And I think that's the most important thing. So, you know, I would be remiss if I didn't say that my partners here, and I am certainly no expert, but the folks on this panel beside me have been very hard at work for years as this problem has escalated, and I have no doubt that they will be for whatever it takes to make some kind of dent in this and bring this under control. And, you know, as the commissioner, I just want to be there to provide whatever resources that I can as they do that. And I speak on behalf of my agency, all of my caseworkers who are working with children and families and individuals suffering from this. I'm pleased to try to find solutions alongside such a talented group of people, and most importantly, a community that cares. And I know that you do, because I hear from members of this community every day, and I can see that the turnout is here. It's a start. It's not finished. It's a start. But I'm encouraged, and I think everybody coming tonight.
Knitting a lot of the work together. And there's actually 2 documents that Claire produced, and they're really great documents, and they're back on this table. I want to make sure everyone takes those home. Make sure you take resource material home, but the Healthcare Consortium really addresses virtually every issue, public health issue in our area. So thank you, and thank you for coming.
And I want to say something to that too, Keith, is as a supervisor, I looked at Healthcare Consortium. I would thought they were buying people around the county and taking them from our senior citizens to different events. But as I got to know Claire, the Healthcare Consortium really does a lot for the Columbia County, much more than most of us would know. And not only that, Claire as a director is a great mediator. She's really the common voice for us, and it's kept us on the right track. And so like I said, she's not sitting here at the panel because she goes sit over there and take notes, but she really is, what is trying to help to keep us together, keep us on the right track. Great.
Okay, we have a pretty broad spectrum of knowledge here on the panel, and I think it was put together with the idea that we should be able to answer most any question, and hopefully that's the case. So why don't we open it up for questions? You can ask a question directly, or I'll try and point it to the right person. So please, let's start. Yes, sir.
Hi, Keith May. I get that this is a crisis that's expanding, but I don't have a good sense of it. I'm hoping you can perhaps tell me, is what are the sort of the metrics of this crisis, and how has it been growing over time, and what are the various aspects of it?
Well, I certainly don't have an answer for the whole community, because the people that I see are people who are in the treatment system. So that's my viewpoint. I don't know what's out there. I hear things anecdotally, but I can tell you this. We have got to keep statistics every year that we feed up to our state office, and then they feed us back aggregate data at the end of the year. I've been with the agency now for 39 years, and for as long as I can remember that they've had these reports, the top abused drug or drug of choice in Columbia and Greene County has been alcohol. The second has been marijuana. And the third has usually been cocaine. And that's been true for many, many years. These last couple of years, the opiates have been jumping up and up and up. And I believe last year or the year before, they were second. Not last year, the year before that they were second. We just got the data in a while ago for 2016. And alcohol has lost out to opiates, which is phenomenal because alcoholism is still incredibly prevalent in both of our counties. So when you add it together, heroin and other opiates, it was probably 30 or 40 units higher than alcohol was. So we have seen this come from like alcohol's here, come up like this, and all of a sudden go up like this. So I can tell you that from a treatment perspective, it's pretty much about 75% of what we're treating now, and it used to be maybe 5 to 10% 10 years ago. That's huge. Now, how are we treating an outpatient? First of all, a lot of people get referred to detox or rehab first because the nature of their problem is so critical that they need to be inpatient somewhere before they come outpatient. Our medical director prescribes both Suboxone and Vivitrol. Remember, these are voluntary treatment programs, and taking medication is voluntary. So we can recommend that somebody would be a great candidate for Vivitrol or Suboxone, and and if they say, I'm not taking it, there's nothing we can do about it. So other than that, it's all the behavioral counseling that goes along with that we can do. I would strongly recommend anybody on any medication-assisted treatment, Laxone, Vivitrol, methadone, whatever, also be involved in a treatment program and counseling program. Medication in and of itself rarely does the trick, because as I said earlier, it's not just the drug, it's a whole bunch of other things that your whole life that needs to get kind of revamped or reset. So, again, that's just my perspective. I'm sure law enforcement has a different perspective. I'm sure that the DA's office sees things in a lot broader scope than I do. But that's what's going on in the treatment program now. It's absolutely overwhelming.
Keith, I can follow up on that. The matters that come into my agency, whether it be through a prevention case, a foster care case, a CPS case, the statistics that Beth just read off are exactly the way it was traditionally, which is alcohol, marijuana, and then all other. And that was traditionally the case. So if the child had to come into care, the problem in the home, if it was some sort of alcohol or substance abuse problem, alcohol was usually top of the list, marijuana came second, and then other drugs followed after that. That was the case with other counties. I know in my building, opioids and more specifically heroin have also jumped to the top. I was just at a commissioners meeting 2 weeks ago, and that is the same across the state. So if that's any indication, it looks to me as though opioids and more particularly heroin are now leapfrogging these issues, these other issues, and it's what we're doing.
When we consider substance use generally, not specifically, I think the context has to be considered. You mentioned the word metrics. If we think about substance use disorder as a brain disease that might be said to have as a primary symptom denial, but is best self-diagnosed, how do we count that? If those who are impacted are reluctant because of the symptoms of the disease to come forward and seek treatment, how does that get counted? If there is a presentation at jail that is not, it doesn't come up as substance use per se often. It's often a symptom of that. But does that get counted necessarily in an emergency department? Do we count the proximate problem, or do we to report it as secondary to substance use? When there are deaths, is the cause of death identified as a substance use related death? This is evolving, and as the science is evolving, but there's a combination of things, and stigma is probably a big part of it that it's difficult to count the communities, the impact of the community. What Beth is talking about, the treatment population, is the tip of the iceberg. Those are the people that one way or another make it in or are forced into treatment. Most individuals are not in treatment. We believe that to be true, but it's really difficult to measure.
Oh, hi. Hi. My name is Karen Martini. I'm a Hudson landlord. For the past 10 years, I rent rooms, mostly single guys, and about 95% end up being either active drug users, heroin and crack, or they just get out of recovery, they come to my place and they start using it right away. I do have a couple of suggestions from what I've heard from people. The first, the mental health one, it's my understanding, if somebody goes into the mental health department for counseling, then they have to fill out papers or interview, and they are asked a question, are you an active drug user? And then if they are, they're encouraged to immediately go to a program. I would suggest that you do not ask them if they're an active, anybody, ask them if they're a drug user, because these people will have other problems, all right, that would be good if they solve them, would give them the strength to maybe overcome drug abuse. For example, I know one guy, he lost his 7-year-old child and the woman he loved in a fire. And every time he's arrested and put into the county jail, he's thinking of suicide because that's all he does is think about that. He's never going to have counseling. All right? So I think they should have counseling, not be asked about drugs, to maybe about the 7th session with a psychiatrist or something like that. Okay, I think that some of these drug people would go for counseling if they didn't have to worry about going to rehab, because they want to go to rehab. Okay, second thing, DSS. And this is what I've heard from people. Okay, they go to DSS, you check them out. If they are drug users, let's say between couches, they go to Twin Counties, they have a relapse, and immediately, just about a lot of the time, are taken off DSS and put out to the street. They lose their housing. I would suggest you don't do that. It's very hard to stop drugs. I think they should be kept in the program and just keep trying to give them counseling and keep them in the program. Because it's really almost close to being impossible for them to stay off these drugs. Even when they get off, they'll relapse 5 years later, a year later, 6 months later. But a lot of these people have serious social, psychological problems that have to be worked at. And the other thing is, how come there's no active drug users here to help solve the problem? I know many active drug users that can talk very well. I'm sure you guys all know too. They can really explain the problem, how they feel, how it grabs them, and I think they should be part of the solution. The only way you're going to get them is if you don't immediately put them into rehab, because they don't let them rehab. You got to let them come to the point where they want to do the rehab, not to push them like DSS does. The other thing, the kids in this house, the poor kids. Families can't even bring their kids to a movie or McDonald's. All right, they have nothing to do, so they play basketball. Well, aside from being a landlord for since I was 24 till 1997, without money, so it can be done. Without money, I used my talent. I didn't have a record player, I had no ballet bars, no costumes. I went out and started a ballet program for 20 years, got New York State Council in the Arts Grant and National Ballet Grant. Started a ballet program for inner city black kids and poor kids to do, in Poughkeepsie and then in Newburgh. We have a lot of talented New Yorkers here. They come into our town, take over the housing, make it hard for the locals, but yet a lot of them are very good people. They're artists and all kinds of things. Why aren't there ballet programs? So why aren't there lots of art programs? So I think that the New Yorkers should be encouraged to pay back in this town. The cops. I think the Hudson cops are great. I think they do a fantastic job. I would just encourage them to go for more of the counseling, but get the big deals, the big, not those little small dealers. They're just doing it just to get their drugs. But anyway, I guess that's about all.
As a person in recovery myself, as somebody who lost a brother to heroin overdose a little over 2.5 years ago, and as somebody with friends that are still out there using, I'd like to know what would be the plan in regards to the next time a bad batch comes around like that, in regards to basically a notification or an announcement, something to make it clear as soon as the police or anybody is aware that there's a bad batch going around and there's countless overdoses, that it be broadcasted across Facebook, that anywhere, so that people know that there's a bad batch out there, and to be aware of it. If there's a way to like address it sooner, because I feel like when it happened 2 months ago, it was addressed a few days after the fact, you know, and it was a 24-hour period of massive amount of overdoses, you know, and it,
I think that's an excellent idea, because you would also get the users on top of the game fast and pretty much not wanting in your territory anyways. So you might get some feedback from acting that rapidly from the users that you can help. They know more than you do, I would say.
The problem with that one batch there, I mean, can't get into it too much because it's still an ongoing investigation with us, the state police and DEA. But it did happen so quick. And that's what the problem was. It went out so fast. There were so many in such a short period of time, like you said, 24 hours.
Right.
And then the word did start to get out that there was a bad batch and everybody stopped. We are on top of that one. We're working that one. And hopefully we will have that come to a good closure where we're going to get somebody on it.
Greg, in one of our earlier meetings, I think, where you were cited, you made the point that we had our little group meeting shortly after that weekend. You made the point that it's, you know, out on social media, you know, all that information's out there, perhaps before, you know, it's officially out there. That's probably something we should look at, is, you know, just improving our communication about those things. But,
Social media is a tremendous tool. We had 60,000 hits off of different things. We had the poor kid last weekend. And it's a great tool. We're starting to track more as far as where the deaths are happening, where the overdoses are happening. And this is across the regional area. It's not just here in Columbia County, up in the Capital District. And as far as tracking, again, I can't say too much good on the cases, but as far as the stuff, there's a lot more in-depth investigations going on now. It has been for a while, because whether we go state or whether we go federal with the charges, our DA's hands are tied sometimes because of the laws in the state of New York. But we're trying to get the most bang for our buck, and we got a great DA. And this guy's nonstop, and he'll go as hard as he can after these major dealers that we do go after. And this is why we have people assigned to DEA, because we go after those major people. People on the streets are selling to keep their habit going. We understand that. But that being said, we're still committing felonies. So, but DEA, we go after those major dealers. And we work very close. The DA has people on task forces with us, and we work very, very close with the district attorney. Thank God that I do have him here helping us.
Kate, I just ask, I think it's a great idea. I mean, intuitively, it makes sense to me. Are you aware that broadcasting that bad batch would be in any way attracting people to the bad batch?
With fentanyl, I don't believe so. Because people that are using are scared of fentanyl. So if it's made clear that these people are overdosing and they're being Narcan 4 or 5 times, and the reason why it's not being effective is because it's not the heroin that's overdosing, it's the fentanyl, they're gonna realize, oh, I don't want that. I want my heroin, I don't want the fentanyl. The dealers are doing that to make much more money. You know, like that's not what the users actually want. So if you broadcast that there's a bad batch with an extreme amount of fentanyl in it and a small percentage of heroin, they're gonna use. They're either gonna go sick for a few days or they're gonna find another dealer for a few days. But like if they find out that there's a bad batch and they talk amongst themselves and figure out where it is and know that there's fentanyl in it, they're gonna find it. They're gonna go someplace else to get their stuff. So it's like the sooner that is broadcasted, like I said, in whatever way, officially, unofficially, just made known to the public, I feel like that it would just be a tremendous help.
So like an Amber Alert.
Basically, exactly, yeah.
Yeah. So to that point, the beauty about us doing this plan, as I said, is we wanted it to be holistic. The people that are sitting up here, the majority of them are representing the county and agencies that are receiving funding from the county. But the plan itself is to incorporate, there are a lot of other agencies in Columbia County who we hope, who are at the table, we hope that others will end up at the table. For example, CPR, because I know CPR immediately put that up on their website and broadcasted that out. And I think that's a great idea, and that's probably some of the conversations that we as a subcommittee will get into. I mean, we're talking about other ideas right now, and I'm sure we have working groups that we have established, and we probably will have those kinds of conversations as well. We're learning as we go. Yes.
Hi. Look, I want to thank you for your comments. I don't know your name, but I'm Bernadette Powers, and I think you should be a consultant, and I think you should be. I'm very serious. I'm very serious because you're talking nuts and bolts. You're talking reality, and I think that's absolutely so important. And you know, in the nature and extent of the problem, it quantified or it mentions high poverty rates are a part of what's going on here, and together with lack of transportation, lack of health care providers, and barriers to access insurance. So I think, you know, I think we have to start looking at a bigger picture of what is driving people to utilize the woods and to see what services do they need to actually keep them from reaching that point. And so that's just my 2 cents. The other thing, I heard a lot of talk about metrics. I looked on the county website, I can't find any metrics. So we have metrics for like opioid-related hospitalizations, related deaths, Narcan deaths, deaths from opiates. Where are those statistics?
That is on the health department website, so you have to go to the county website and then click on health, it's one of the banners up top, and then there is a full community health assessment available for the entire capital region. So it's a little bit to sift through, but we're in there, and it's pretty easy to get to.
Right, because you were saying the numbers
but
are
it's all
already
there.
out for 2016.
I don't think those are included because this was for the year 2016, so I think the most recent in that document is 2015. And that's part of the issue too, that all the data it's so slow to get to us.
Our agency's data is much newer because it's only our agency's data, it's not the whole county.
Well, I think a lot of this is not understanding as a citizen where the problems are. I mean, where the issues are, and just finding information is sometimes difficult. So it would be helpful if there was more information out there rather than less.
Easy to get.
Yes, easy to access.
Yes.
Hi, I'm Beverly. This sort of tacks on to Bernadette's, but I was wondering, as you've seen the change that alcohol has fallen and with opiates and kind of that dynamic has changed, have the demographics of who's using changed?
Or younger. And by the way, alcohol isn't falling, it's way.
I should say
I know,
Right.
no, you're right.
So fast.
Right. Yes, yeah, the demographics, because we get back clients by age, by race, by gender, by all kinds of different economic level, of all kinds of stuff you feed it and they get it back. And one of the things also is females are rising. We always had way fewer females in treatment than males, and now they're starting to move up. And also the average age of the client is now shifting down. Part of it is because of, I think, the drug use, not so much the alcohol use. Because the alcoholism takes longer to develop and longer to be identified in the general population. So people would usually hit us in their late 30s and their 60s. The opiate use, we're getting people now, I would say, the largest population we saw was between 25 and 42. Not that there's not a lot lower, but that's like where it balloons. So,
Yes.
I have a comment, I guess most of you, but like, I would like to see the board of supervisors task the towns with creating a town version of this response plan. You know, take the best of it and figure out how they can apply it in their towns, and to follow up on Bernadette's, create town data so that people who think they live in these little safe communities realize, no, this is in my backyard too. You know, be a key mountain source of the problems in the county. And then to top that off, have the county board of supervisors create, spend a few bucks, get a graphic designer and create a card, like a palm card, and send it out to the towns and mandate to each town that they have a work group on their town board dealing with this issue and creating their town plan and distributing information. So I really think there is an information backlog.
Right, so to that point, I'm only laughing because it's the critical, and that could be partly my fault. That recommendation had come to actually me, probably a couple months ago by Keith. But when we had the whole batch of overdoses, it shocked all of us, and it changed even our conversation of how we were going to approach it, because initially we had the idea is we were going to come up with palm cards for all the supervisors of all the towns, outlining all the information, services, and how to get a hold of those services. And we're still going to do that. We just got redirected when we had the whole, that large weekend. But as far as looking at the other towns, we really globally were as far as being in the county, when we talk to each supervisor, we make it clear that, at least I do, is that don't try to point the finger at any individual town, because I can show you in pretty much every town. And I myself, outside of these guys, I called them the agency in Albany to ask for the data myself. And I started disseminating that to the various supervisors and show that, no one particular town, specifically Hudson, was leading over any others. It really is not only countywide, it's statewide. And if you're gonna put your head in the sand to it, it's just your community that will pay the price at the end of the day. So you're right, we did take note of that early on, and we're still gonna do that. We just didn't when it was first brought up.
And put in this county plan to make each town have their own plan. That should be a required step, in my opinion.
Ms. Patrick, I am a recovering drug addict. I got an email about this and I'm come for one thing. This is something I heard on the radio station I listen to quite often, and it's about Hope Rocks. It's down in Saugerties. It's next weekend coming up, 19th and 20th. And what it is, it's free admission. So for maybe Twin Counties Department passes by that people are in the program, this is something they're gonna have 40 bands, and it's all about drug awareness and suicide prevention, because that is the month of August. I was in vacation in Maine 2 years ago with my girlfriend. They actually did, in Portland, Maine, down Main Street, over 1,000 people did a drug awareness walk in the middle of the square. You ever thought about possibly maybe doing one here in the city of Hudson, like as an organized thing, just like do a walk down and meet up down at the bottom in the park? But this card, if you more likely have it, if you want to have this is like, it's all the information about this thing that's coming up. It's a festival. It's their first year doing this, and it's about drug awareness and suicide prevention. Addiction, actually. And there's different stuff that's going on there this weekend. And the person that I talk to on a regular basis is Department of Narcotics Anonymous. He's the public relations chairperson, and they approached the public relations for Narcotics Anonymous to be present, to just have literature set up so people can take things, and where to find meetings, what we're about. I know it's an anonymous program. There's 4 meetings alone in the city of Hudson. I go to them every night. Matter of fact, there's one going on right now. Normally, there's 6 people at the meeting, and that's how bad the epidemic is. There's 6 people at this meeting usually, Monday, Tuesday, Thursday, Friday, just here in the city of Hudson alone. It drives me nuts. Why not? Because there's an epidemic out there. Twin Counties, DSS. Back in the state of Maryland, when I lived there for a while, people were mandated to the drug court program. They come in, they're on drug court. I don't see no paperwork coming up to the person of being the chairperson of these meetings. And could you just say I was here and put your initials on this paper? That's all we do. We don't put a phone number, I just put my initials on as a chairperson. I don't see any of that coming from this city, in this area at all. You know,
Can I address a couple of those things? First of all, thanks for bringing up Hope Rocks. We're aware of it. We've been disseminating information, and I think some of my prevention people may actually be attending that. So thanks for bringing that up. It should be a great event. What was the second thing you were talking about?
Like when you people, the meetings I go to, guys come in from the drug, you know, the drug court things. They have nothing, you know.
We can't anymore.
You can't, okay.
We can't, and I'll explain a little why. I don't know the legal technicalities, but several years ago, our state, we used to do that all the time. And then we review the meeting list and check it out, blah, blah, blah. Several years ago, our state office came down and said to us, you can no longer, first of all, mandate that anybody go to a self-help meeting. You can't do it.
Wow.
We always used to. That used to be part of going to treatment. You couldn't be in treatment if you weren't going to comply. We were told you cannot make anybody go to a self-help group anymore. Now, we still strongly encourage and we drive them there, et cetera, et cetera. But the other thing was, you can't walk in, you can't have them walk in with sheets of paper and having people sign it anymore. Part of what people were doing was just walking in, having somebody sign it and walk back out. So it didn't really prove anything. Then we changed the type of sheets we were doing. You have to talk about the content of the meeting, not just get a signature. Well, people have wonderful imaginations and wrote glowing epistles about what was going on in the meeting that they never attended. So, I mean, for some people it was valuable, for some people it wasn't, but the state told us to stop, and that's why we had to stop. So, I agree with you in heart, but, you know, I work for a place that gets state money, I have to go by state regulations. I mentioned earlier that we have men's and women's residents in both Columbia and Greene County. Length of stay there is generally between 4 to 7 months, depending on how someone does. We have a waiting list for both of these houses and have had for years. It's huge. We never have enough openings for people. And that's really very sad because that was going on. It's not like people are ignoring the lack of services. We've been trying to get these services locally. But even if tomorrow, again with the wand, somebody showed up and dropped the money in my lap, it would still take a couple years between building, renovation, licensing, blah, 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 hiring staff. So I'm asking you as a community to be patient as I try to move forward with this. And if anybody knows of anything we could do in the meantime to help with this particular situation, I'd love to hear from you because we have an awful lot of people that need these kind of services.
We've been working on that for quite a long time. It's been a real main focus of our subcommittee. I myself, along with the commissioner and a few of us that sit up here, have been looking at properties, talking to real estate people. I mean, we put a lot of time and effort into doing that. And one of the big news is the Chairman Morrell and I requested the governor's office along with some executives from Oasis to come down to answer some questions for us and also to give us a hand with that, and they did. They came down, they spent the whole afternoon with us. We told them about our plans, what it is we're looking to do here in Columbia County. They're really encouraged and talking to us and calling us on a regular basis. They see that we, the Board of Supervisors, are all in. We're doing whatever we can and what is being asked of us. Going from last year to this year, we're still in the reactionary mode because it is government, but our turnaround time when a request is made is almost light speed for the government. I certainly, appreciate Chairman Morrell and also Chairman of the Human Services Committee they gave me a lot of latitude. Look, I'm sitting in a committee with these guys, and I'm able to speak with the board of supervisors, and we're able to get things done twice as fast as if we went through the normal committee process. And that's just to the fact that we recognize in Columbia County what the problem, how severe the problem is. And we reached out to Chairman Lewis in Greene County, and they too recognize it. So I'm working with Aiden O'Connor, really to fight it. We're certainly open to other counties, but our focus is Twin County. A lot of these agencies up here work in both counties. So it should be an easy do for us to work in a dual county fashion. But make no mistake about it, we understand the magnitude of the problem in Columbia County, and we're willing to put our resources behind what we say. We're working hard on it. I hope that comes across. That's what we're doing.
Yes.
Yeah, I wonder if you could address a little bit the change in language now, that is now, we're addressing it as a disease, or I'm not sure quite what the terminology, but it's like a sea change, just before, you're just stronger, tougher or something, would be an addict. And you're talking about the putting people in jail hasn't helped either, and now this whole seems like a really new approach to call it disease. And obviously if people are playing Russian roulette with fentanyl, they're all suicidal, so that really should be, I think it's a great idea to join a couple of groups together. But if any of you could address just the change in language.
The language among people who have been working in the field hasn't changed. In 1955, the American Medical Association declared addiction a disease. That's quite a while ago now. But for many, many reasons, mostly cultural, we haven't caught up with that as a general public. And there are still a lot of people who don't believe that at all. But it has been proven probably 20 years ago that this is definitely a disease of the brain, that your brain, for some people, when they use, their brain chemistry changes, and the priority for that brain, in very simple terms, becomes the drug over everything else in their life. That's as simple as I can say it. Why do some people drink alcohol and not become addicted? Some people have a predilection for that. Sometimes there's a genetic predisposition. We don't have all the answers, but we do know with any kind of addiction, it impacts the brain and the way it responds. Now, why do so many people who use heroin become addicted to it? And not all do, by the way, but most people do. Because it's way more powerful. And the more powerful a drug, the higher rate of dependence or addiction you're going to get. So it's not really, it's new for the community, it's not new for us. We've always thought it was a disease. It used to be considered a liver disease, now it's considered a brain disease, and sometimes a liver disease because some people process certain drugs or medications or alcohol in a way that's very different than normal people, so, okay.
So, hi, my name is Lori, and I have a couple of questions. I've been on this long journey with my daughter for probably 12 to 15 years with substance use disorder with heroin, and it was always so frustrating that there were not enough or none services here in our area, and it's still, obviously it's still the case. She did go through Twin Counties, and I was so happy that it was there. She's been in and out of recovery on and off. She hasn't been totally actively using all those years, but it's been a struggle. I have two questions. One is, are we any closer to getting a detox unit in Columbia Memorial Hospital? And the second question is for the sheriff. In the press release that went out for this forum, there was something stated that somebody quoted you saying, if a person on the street needs help, they can come to the sheriff's department and we will get them the help they need. What is the sheriff's department? What does that statement mean?
Our protocol, if somebody comes into our office and they need help, I call the expert, I call Beth. We get them down to Beth, or Beth comes up to us and we turn them over to Beth.
So even if somebody were to come in at 8 at night or something like that?
Yeah, that's our protocol.
So does that mean you have some kind of after-hours connection with Quinn County?
We have a 24-hour answering service that anyone can call, and they are connected with a therapist if they would like to speak with one, or they can be told to come in at 9 o'clock the next morning. Yeah.
About 2 weeks ago, Beth and I met with Jay Cahalan and some other administrators from Columbia Memorial Health Hospital, and we had that discussion. Hospital-based detox, crisis stabilization, non-medically medically complicated versus not complicated. There are a variety of different ways that we can offer detox services, and we probably need that variety locally. Some development, the inpatient development is I think a little bit more of an uphill slope. Beth just spoke about basically an outpatient detox crisis stabilization setting. The trend is not to support more inpatient services, just generally. So it's bucking the trend a little bit, but I think the state is recognizing that. I think the federal government is recognizing that. And so we got the administrators from Columbia Memorial Health to have the conversation again. They had a formal detox many years ago and discontinued it. And they're interested in having more discussions. They want data about the prevalence and the number of people who would benefit from a local hospital-based detox, but we are talking with them, which is progress.
I would like to mention one thing about detox. A lot of people think about detox as the place to go when you first need to get help. Because my opinion is, if you feel like you're going to die and you finally show up for help, why would you say to somebody, you don't need to be here? Because I will say at least 50, if not 75% of the time, many people that are suffering from opiate addiction don't have a stable, supportive environment. So to say to somebody, no, you're not appropriate, go to an outpatient clinic, when they're living in the middle of a house with all other opiate addicts, go stay there, is ludicrous to me. So I think rather than try to have that argument, we should have a whole paradigm shift on what detox really is, and does it have to be medically necessary? Can mean a lot of different things, you know. Sometimes socially necessary is what's going to save somebody's life. So I get what you're saying, believe me, I get it. Hopefully we'll get a crisis stabilization service at some time, and we can keep people at least for a couple days and try to connect them with something. We also need sober housing, because we need a place to have people live where they're not going to be around other addicts.
I'm Wendy Paul, I'm from the Chatham area, and my son has tried longer than I have known in and out of detox or some kind of help. He has been on Suboxone, but then he lost his job. So, you know, they do lie. So I talked to him about going to the Chatham's department to get help, where I guess if you bring in, well, you can take yourself in 10 to 16 hours and
I don't know, the gentleman's in the back that could answer that, but.
well, anyways, Suboxone, he told me once that he went for help along his path, and he was turned down because he was on Suboxone. So.
He went to go where?
Yeah, went to get some kind of help.
Oh, to rehab?
Yeah, and they turned him down because he was on Suboxone.
Mm-hmm.
So, what's with that?
Well, they probably figure if he's already getting treatment, why would they take him into a place?
No, I don't know. He tells me that it takes longer to get off the Suboxone than would heroin.
Yes. Well, yes.
He doesn't want to stay on Suboxone.
you need to taper. As with any medication that's, addictive,
Yeah.
you don't just stop it without some help tapering.
He has told me that Suboxone depresses him.
Well,
It's
it may.
depressant. And that's where heroin comes in. Heroin is just like the drug of dreams, where a lot of the other drugs, even drinking alcohol, is not as satisfying as heroin gas fix for.
Well, all I will tell you is it's really hard to say that the impact on one person is going to be the same as the impact on another. Everybody has very different physiology. It depends on the dosage. It depends on the quality of what you're taking. There's so many variables that you can't really make blanket statements about everybody goes through this or that. It's sometimes very different. But also remember that people do tend to fabricate
I know that.
what really happens to them or doesn't happen to them. So.
What's real, what's not. Well, with him, what happened is, I'm gonna just compound it by saying, I am worried now because his girlfriend just got raped. So now he has, and she doesn't use, she's not used, okay?
Yeah.
This is what I am told. So now he's compound with, how do you do with that one? I am worried. Suboxone isn't working for him, like you said. All chemicals are different in everybody, so why are they treating it as if it is not?
Well, let's just assume that he does what you would do with another medical condition with medication that's not working. You would go back to the prescriber and you would say, this isn't working. Give me something else, refer me someplace else, do something else to help me. And you advocate for your own stuff. He doesn't have to stay on it, he can switch and taper.
I'm going to tell you where I'm finding a problem with your statement.
Okay.
You're not addicted. You're not the addict who has to go back to his doctor and try to advocate for himself.
I understand that it's difficult.
Okay,
He's talking to you about it. You can go with him.
Okay, huh?
You can go with him if he'll let you.
Okay, well, that is a good question.
I get
Very
it.
good question.
Listen, like I said, I've been doing this forever. I get it. I get for every answer I give you, you can give me something that refutes it. I get it, because I've heard it for years and years and years. So I guess all I'm telling you is there are options. Whether or not he chooses to use them, it's going to be on him.
And also, he lost his job, he lost his job. So at the same time, going back to his provider might not be as easy as one might want it to be.
I get it. He sounds like he has a whole bunch of issues.
Yeah. He tried, and I'm sure some of the others have, and,
So give me a call and bring him in. I'm serious.
Give you a call and
Give me a phone call and see if he'll come sit down with you and me and talk. Not formally. I'm not making you fill out forms. I'm not doing any of that. Sit in my office and chat. Okay, I'll give you my information.
I would like that.
I would like that too.
See what happens there, right?
Let's go.
One other thing. I think it was 1995, 96, when I first started renting rooms. I got 5 bedroom apartments to live. And the first thing I started with was, I think it was Red Door people and some other people. I remember Anita Race, she's now dead, you might remember her. Her and there was about 4, a couple and another guy. There was about 4 or 5, and they had just gotten out of rehab. And they were at my place, I think a year, and they did well. They had their own rules and everything, and it worked, and I would go and talk to them. The one thing, I think that's a good idea if you get some landlords in on this, but they should, and I tried to check this out, but I didn't know much at that point. But if mental health or one of these groups had these kind of apartments where they all live together right after rehab, and they had somebody come in once a day just to make sure everything was okay, a little bit of counseling, something like that, because they did well. I found when they went through the rehab and the counseling, they became very good talkers. They all sounded like college professors. I would sit and talk about drug addiction with them and all that. And they were very verbal, very expressive. But they still need a little bit of counseling when you put them in a situation like that. You need with somebody that's watching out, which I did, but then, you know, I didn't know much about drugs or anything like that.
Supported housing.
Yes.
So that's a good idea.
Supported housing.
Supported housing.
Huh? I said it's called supported housing.
Yeah, yeah.
Yeah, no, it's
Yeah,
a
but-
great idea.
Yeah.
It's really good.
Because when they first got out of rehab, they know, I found, at least from that experience, they did pretty good on their own. They really did. And I don't know what program they went through, but they were very good. They were all determined. They would discuss things, there were rules, everything. Yeah.
Hi, my name is Eleanor Kinney. I just want to flip the switch a little bit. Firstly, I want to say thank you to everybody, every single one of you on the panel for doing this, because this is an epidemic. It's out of control. Something needs to be done and addressed, and if it weren't for you right here giving us ideas and ways to fabricate things to try to stop it, it wouldn't happen. So I commend you greatly. What I'd like to go ahead and touch on is Mr. Schenker had said earlier about how the disease affects the victim, but also the families and friends of the victim. With that being said, I am directly involved with people in my life who have suffered addiction. Without Riverside, my daughter wouldn't be here today. She went in 5.5 years ago. She's healthy. She has 2 beautiful little girls. She's doing well, and I commend the program. Without it, she wouldn't be here. I can tell you that. On the other side, what do we do as friends, family members, moms, dads, brothers, sisters? What is there for us? Well, the answer is, there is a program out there known as Nar-Anon. It's affiliated with Narcotics Anonymous. And I am right now working to try to resurrect 2 meetings. One in Catskill, which may be at Twin Counties, and another one here in Hudson, which I'm hoping might be directly related to working with Twin Counties. I'll need a spot here in Hudson. So I just wanted to let you know that I've been working in conjunction with several other people. It's open for people in general who have anybody that is directly involved or affected by the disease itself. So when I get them going, I will let panel know. I will hand out flyers. On the flyers will be most likely the 1-800 number for meetings and the narnon.org address for people to be able to reach out, and then that way they can go ahead and find out where our meeting spots will be. So I just wanted to share that with everybody, to let them know that even though we're fighting for the well-being of the addicted person, we can't help them if we're not well ourselves. So we'd be completely lost if we didn't do that to make ourselves strong enough in our aspect of life to be able to even support them, because we don't know what to do. They're so lost and they're so far out in their own way that, you know, we suffer also. We don't know what to do. And even though, you know, my family members are in a place right now where they're abstinent, I'm still suffering. And I've been working with program for 30 years, starting with my children's father. I've been in and out of rooms, I've been in and out of programs. I've seen both sides of the candle. I am a sufferer of children and family members and whatever. And I've seen the addict's side as well as a support person for them. It's time for us to have a support system for ourselves. So I just wanted to relate that to you, that as soon as I get that up and running, I will let everybody be aware of that.
Thank
So,
you.
Thank you.
I apologize, I didn't get your name, but You are exactly why we actually wrote the plan we wrote. Is because a lot of these people up here have been in the trenches for a long time, and we as the county know that. And so getting all of them under the same tent was a smart thing to do. But to actually codify a plan and put it out there and say that we want it all encompassing, that we not only want these people here, we want people like you that stand up and say, I have an idea, can you guys help me with that? And then we now will meet as a subcommittee and we'll start having conversations about what it is we can do to incorporate some of the ideas we get from all of you out here in the audience. Don't think we're not listening, and we have to play on what they can do, as you know. So we are paying attention, and hopefully we can help you with the program.
Wonderful, thank you.
Not a lot of people know we're out there, even though we're putting flyers and stuff up. So if you guys can put us in as resources, I know we should have a slide running at mental health. I'm pretty sure the Department of Mental Health has a slide running across that advertises our meeting. But yeah, so it's every Wednesday at 7 p.m. in Chatham at the Morris Memorial. I guess it's called Krellen Morris Memorial now. So keep that as a resource if you would, because we definitely meet every week. There's someone there every single Wednesday, and it's a really, really supportive group for just coming and talking, even if you don't know what what you want to say. You just come and sit and listen. Everybody cries. People should know it's an anonymous meeting. You don't have to sign in, give your name, give your situation. You don't even have to talk about the person in your life who is affected by it. So it's a great group.
Any final comments, panelists?
The final comments. Look, for me, this obviously I'm a politician, but for me, this isn't about politics. This is about the community environment and the community at large, in Hudson and also in Columbia County. Each time I hear of a soul being lost, untouched, anybody who knows me knows I'm sitting Monday through Friday at Novitas, and when I heard the loss of a soul there, I was just devastated. And immediately went into crisis mode myself. I just didn't know what to do. When I contacted these guys up here, in the first response, they were like, well, and that really came from Beth, let's train the restaurateurs so that they would know how to respond. Because one of the things when I talked to some of the owners, and I talked specifically to owner leaders, they didn't know what to do. So we reached out and did Narcan training for the restaurants in Hudson, and we were looking to expand on that. Unfortunately, we had the shortage of Narcan, and we had to postpone that, but then hopefully we'll pick that back up. But the point I want to make is that for me, and I think for everybody up here, we're putting in a tremendous amount of hours. I mean, I'm not saying that to brag or anything like that. It's more that, just like all of you, we're really passionate about this. We know that people's lives are at stake here, and we have the power to make a difference. Not just us, all of us. We have the power to make the power to make a difference. And I think this was a good, healthy first meeting. We can come together, put ideas out there. There's a lot I don't know. And I'm sure there's a lot that, you guys don't know, and same with us. But all of us collectively together, we can do this. We can do this.
I think that doesn't need any follow-up.
Okay. I want to thank the panel. I really want to thank everyone. For being so open. To talk about the things we talked about. It's a tough subject, and we all appreciate everyone's openness. We have a second forum scheduled for September 14th at the Kidder Town Hall, 6 p.m. We have a third one tentatively, have to hold the panel at in Copaig, September 26th. So once I get confirmation from everybody, we'll schedule that one. But the next one is scheduled for the 14th of September. Have a good evening.